The second method includes so-called transcranial direct current stimulation. In this method, we simply inject the constant or direct current into a particular area of the patient, in this case into the temporal areas. When the current goes through the cortex, it activates pyramidal cells of the cortex, and in a way it's improve the information processing in these areas. And in this case it was quite clear what we need to do. We need to suppress slow activity using neurofeedback and to activate the temporal lobe using the transcranial direct current stimulation. And actually we asked the practitioner to do this, to do this two different methods of basically of activation the temporal lobe, which were suppressed and were functioning quite abnormally in these particular patients. So after several sessions of neurofeedback and several sessions of transcranial direct current stimulation, we recorded the patient the second time, and we were able to compare the EEG, spontaneous EEG parameters and event-related potential in these patients with the activity that we recorded several months ago. And we found indeed that this slow activity that we saw in the first recording became much smaller after these interventions, and the component of event-related potentials that were generated in the left and right temporal areas became, I would not call they were absolutely normalized, but they changed towards normality. So that in this case, we saw quite clear indications that our intervention that were intended to activate the temporal lobe and to normalize the information processing in the temporal lobe were quite successful.